Okay, it says that we are streaming live, so I'm going to double check it and see if we actually are streaming live. But if not, we will try again. I think that we are up and going though. Hello, everyone. Happy Sunday from, well, I'm the only one in the Pacific Northwest. Everybody else is not. So happy Sunday from Washington State. My name is Elizabeth Krause. I'm one of the parent coaches here at GIE, and I'm so glad to be with you all today. I'm joined by two awesome team members that one of whom is a familiar favorite. I will let her introduce herself. Hi, Aubrey.
Hi, I'm coming from the Midwest and I am one of the GIE dietitians, lactation counselor, and I have a kiddo that weaned with GIE.
All things. She is all things. This is what we call her. Yay. Aubrey is one of my favorites. I was just telling her she makes me feel so good about myself. None of that, but it does help. It's a perk. And we're also joined by a brand new team member who is no stranger to GIE by any sense of the imagination. I'm super enjoying getting to know her in a completely different new way. This is Stacy Todd. Hi, Stacy. Do you want to introduce yourself?
Hi. Yeah, sure. It's funny. I used to, be on these all the time back in my paid working days yes, my name is Stacy Todd. I'm also in the Midwest in Michigan. And 2.5 years ago, I had my son who has a congenital heart defect and has had two open heart surgeries and weaned with GIE last summer. And I joined the team a few months ago as a parent coach. And yeah, I've been enjoying, and this is my like foray in getting back to paid work. So it feels really good.
Yeah,
But yeah, I, like talking or like introducing myself, I like don't know what else to say except I'm the mother to a tornado like toddler.
who is eating every time I get on a Zoom call with Stacy.
Yeah.
It just makes my life so happy.
Yes, he
I
likes his food.
Yeah. Yeah, he's a fan. This is like such a special call because I was Stacy's parent coach when she weaned. And Aubrey, I sort of took you on after like post wean when you needed one. So it's pretty fun. Although I was Aubrey's very first call with GIE. So I've basically been here forever, is essentially what that means. That's great. But we are so glad to join you. I hope you're all, staying cool in the hot weather. It's hot I live in Washington, so anything is hot for me. But I'm excited to just talk with you all. Our focus for today, we obviously pick a focus question every time we get together, but of course we want to answer people's questions as we go. So please don't hesitate to put them in the comments and we will get to as many of them as we possibly can. Any ones that seem kind of far off topic, which by the way is fine, or that we don't get to, we will come back and do our best to answer those in writing. So don't hesitate to drop a question and we will respond in the best way that we possibly can. But our focus question for today is this one is a really big one. I feel like it's come up a lot lately, so I'm glad we get to tackle it. It is, does oral eating look like tube feeds do? And I think that can be a prevalent question for families going in because often when we're sort of waking up that appetite and we're not seeing a pickup in oral eating, or we're seeing a pickup, but it's not proportionate or the same volume as we were tube feeding, there can be a lot of anxiety around that. So Aubrey, putting on your awesome hat as a dietitian, when you think about the primary difference between typical eating and tube feeds, what stands out to you as being the biggest difference between those things?
Yeah, I mean, the biggest difference is that with oral eating, we are relying on the child. So their intrinsic appetite and motivation to eat. And with tube feeding, it's all external. Somebody is externally calculating and deciding how much they think that child should have to grow or to meet certain growth standards or expectations. And so it is completely outside of the child's control. So that I think that's a striking difference. It has nothing to do with appetite. It has nothing to do with hunger, and it has nothing to do with satiety. Which is why a lot of times tube-fed kids are overfed, right? So it's just a very predictable, this is what we calculated, this is what we're going to give them.
Mm-hmm. And tell me, like, why? what are the it's a humongous question. Why I'm pregnant. But like tell me a little bit of like why are we doing that? What kind of state or condition is the child in to the point where we literally have to calculate for them what's going in? I think the background is
Yeah.
helpful because it sort of helps us to understand what changes. So what
Absolutely.
you
So I mean, there are a myriad of reasons that kids might end up on feeding tubes. One of the most common is if you had a premature kiddo, especially if they had any medical complications like a heart condition, that can really impede their ability to eat. One, because they don't have the skills. You know, if they're born early, they literally haven't developed the reflexes to be able to coordinate that suck, swallow, breathe pattern. Two, if they have a heart condition, for example, they fatigue really easily. So it becomes really difficult that even if they have the motivation to eat, they can't stay awake or they can't sustain themselves long enough to eat sufficient amounts. And so what we're looking at is making sure that we're supporting growth within a certain trajectory. Now I laughed because there are a lot of teams that want an excessive amount of growth that I might disagree with, and that can mean that kids are put on tubes because their team wants them to accomplish something called catch-up growth, or they want them to gain a certain amount every day. And sometimes those are reasonable expectations and consistent with what we need to keep a kid on a curve to make sure their brain is developing properly, all of those things to make sure that their disease state is not worsening. And sometimes those are just preferences by the medical team and don't warrant that amount of feeding. So it really depends. But a lot of times it has to do with a lack of skill or a lack of ability to, and skill being we could develop it, and ability being they might have a medical complication that increases their needs, or cleft palate kids, something that's impeding their ability to build those skills and to build their efficiency and get enough in to hydrate them or to nourish them so that they can grow properly.
Yeah. Okay. Okay. So tube feeds are predictable. They're prescriptive because kids are in a medical situation wherein their nutrition needs to be prescribed based on their sort of physical or developmental state. Okay. So Stacy, I want to come to you. And I know both of you are moms of former tubies, so I could go to both of you. But Stacy, I want to come to you. When you think about um, Jonah's experience on tube feeds, what stands out to you the most as being, maybe it just stands out to you the most in that experience?
Well, you know what? I was just thinking about or reminiscing, I guess, about like the tube feeding journey. And just for reference, he never got a G tube. He had an NG for 18 months. And the early days, like you talk about prescriptive, like I was giving him like to the milliliter the amount of liquids that were going into his belly, like every 3 hours, like clockwork. And he was my first kid, and this was all I knew. So it was like I was like militant about it. And I remember very vividly we were feeding him every 3 hours around the clock. And one night I like forgot to set an alarm for 3 a.m. or something. And I slept through the 3 a.m. feed, and he did too. Magically, he was fine. And I woke up at 6 a.m. or whatever time we woke up, and I panicked. I like sent a message to the cardiologist, like, I slept through the feed. What do I do? And now looking back on it, it's like, it's just interesting because with tube feeds, it's like you think that you have to have this magical number of milliliters every X number of hours, or something really bad is going to happen. And this was just like my medical mindset, but he was pretty sick, and he had been in the NICU, and we just had this little baby at home. Luckily, you know what, the cardiologist, like dietitian that we were working with, she was wonderful. She said, do you want to get rid of that 3 a.m. feed? And I was like, yeah, I would love to. But anyway, so that's one of my like overwhelming memories from early days of tube feeding, was like feeling like if he didn't get X number of calories every day through the tube, like something really bad was going to happen, and it was pretty traumatizing. But
Yeah, because the amount going into him is what made him safe. Was that your feeling?
well, yeah, I mean, especially with a heart kid, like you think like growth is the most important thing. That's what they make you think. And like the bigger, the better for surgery. And his first surgery wasn't until he was 7 months old. So we were really just like trying to get him to grow. But he really never had huge issues growing. He was small, but yeah, but we were told that like he needed to grow, and the bigger the better, and the better the outcome for the surgery will be if like he gains weight well, you know.
Yeah. Oh my gosh. That's so stressful. Like that's so,
Yeah.
so, so
But I
stressful.
think it's pretty common for tube
Mhm.
fed parents, you know. And that's
Yeah.
one of the, when I think about like how tube feeding is different than oral eating, it's like it's mostly, I think, like such a mind shift for the parents, you know.
100%. What
Yeah.
was the biggest shift you feel like you had to make in that
Well,
whole just examining
I
him?
mean, exactly, this is like realizing that if he doesn't get like X amount of calories every day, he's going to be fine. And I think the thing that helped me most was thinking about like the week rather than the day. Like maybe he's not going to eat like a lot today, but over the course of the week, like, you know, and just taking a deep breath and realizing like, yeah, one meal, one snack, one whatever isn't going to make or break this experience.
Yeah. Yeah. Oh my gosh, the pressure on that though, like that's so hard to translate over into oral eating. So when we think about, I mean, I do not eat the same volume every day. When I logged on, and I was eating some Pirates booty, Aubrey's like, are you eating Pirates booty for dinner? And I said, no, no, I forgot to eat lunch. And she goes, it is not lunchtime, so this is a snack, you know. But I totally ate lunch yesterday. I ate a giant lunch. I was starving yesterday. I could not get enough to eat. And today I forgot lunch completely. So and I do not go into a panic on whether or not I'm going to live with the fact that I ate Pirates booty at 4:11 p.m., you know, because I forgot lunch. Um, and yet that's not our experience when it comes to our tiny, tiny humans. So Aubrey, what is it that changes? Like, why is it safe for an oral eater to not eat like a consistent volume, same time, every single day, day in and day out? Why is that okay when it was such a necessary component to being safe when tube feeds started?
I mean, I think I would start by saying, as Stacey kind of alluded to, it's a myth that it was necessary. Nothing bad was going to happen if you occasionally missed a tube feed, or if you fed 5 milliliters less, or if nothing bad was going to happen. I mean, yes, over months, your kid might have gained slower, but nothing immediately detrimental was going to happen. It was just a mindset that it would. So I
Mm,
think that's really important, is that there is nothing different in terms of oral eating versus tube feeding with respect to it's safe to not get as many calories orally, but you had to get them tube fed. You didn't. That variation would apply and will be totally normal. There are going to be days that your kiddo is going to be more active and maybe actually could have used more calories if we were calculating exactly how many they burned. And there are going to be days that your kiddo is sick,
mm,
is less active. And if it had been up to them, their body needed fewer calories that day. The difference is because we're controlling it, we're going to put them in anyway.
right.
Versus if our kid is in control, they're going to decide whether they need more or less.
Mm,
So I think it starts with understanding that that's a fallacy. Nothing bad is gonna happen if we miss a few milliliters or we miss a feed here or there. Just like nothing bad happens if we as adults miss lunch or don't have a snack or eat less for a meal or eat more for a meal. Nothing immediately bad is gonna happen.
yeah.
So that's the first thing. And I think the second thing to understand is that it's totally different the oral eaters, that they're, first of all, what they are eating might be a smaller volume but higher calorie, right? It might be more nutrient dense, it might be more calorically dense, and we can't tell that because we're not calculating it the same way. So when they needed 4 ounces of formula, they might only need 2 ounces of the avocado guacamole that they're eating, right? Or the cheese sauce that they're downing, because that's got more calories. So it actually needs less volume.
Right.
So we think that variation in what they're getting is also going to impact things. But I loved Stacey's overall picture of look at the whole week. And that's what I say, especially to toddler parents. look at the whole week. Look at the variety for the week. Look at the intake for the week. Look at for the month. You're going to have kids that eat no vegetables for days, and then they eat a ton of vegetables, and then they have none, and then they have a ton. And what does it look like over the scope of that whole time period, not just one individual day? Because that's what's really going to tell us more about the quality of their nutrition, the quality of their intake, not those specific day-to-day, meal-to-meal.
Yeah. Yeah. Stacy, what was helpful for you going through this process when you started to kind of go, oh gosh, like his volumes do fluctuate? I know you talked about kind of looking at a whole week, but maybe a better question is this: how did you start to cope with it? Like, how did you start to work through how can he possibly survive on this
Yeah.
amount of food?
Well, it's funny that Aubrey mentions guacamole or avocados, because I remember like when we began the wean with GIE, I remember just out of I don't know if you would recommend this or not, but out of my pure curiosity, I like looked at what his tube food, what the nutrition content was, just because
Yeah.
like this is how my brain works. And then I looked up like how many grams of fat are in an avocado, and I realized that half of an avocado had more fat than he was getting in a full day of his tube food. So I was like, if I can just get him to eat half of an avocado every day, we're gonna be fine. And I know that he didn't even need that. Like he would have been fine just eating like a handful of Cheerios throughout the day or whatever. Like
Mm-hmm.
but there was something like that was like a stepping stone for me, realizing that like just whole foods and like something that has like dense nutrition in it is gonna be like a friend to me. So I was in the early days of weaning him, I was like mixing butter in his um fruit purees or his oatmeal, and I was mixing sour cream, and he ate like sour cream mixed with avocado in the mornings, like almost every morning when we were weaning. And he loves avocado still to this day. I've had to stop feeding it to him because he just smears it all over his face right now. We're going through a phase. But just that simple fact, like learning that half of an avocado had more fat than he was getting in a whole entire day. I don't know, something about that made me like just sit down and take a deep breath, because I was like, he's gonna be okay, you know. Our real struggle was hydration rather than you probably remember that Jonah like ate really
Yeah.
well when we started the wean, but yeah, hydration was my real struggle. So that was why we couldn't get rid of the tube it took us a while. So
Yeah.
and yeah, I can talk a little bit more about that if you want later, but I don't know if I covered your question.
You totally did. Yeah. And I do actually want to come back to hydration. So don't anyone let me sign off without talking about hydration. I want to go to a question that a parent came in, and Aubrey, I'll have you start with how you would tackle this because I sort of love your feisty approach. And then Stacey, I'll ask how you kind of went about it. So parent was like mentioned that getting over the hurdle of counting every calorie in was really, really hard. So how do you have these conversations with the doctors who interrogate you about daily calories? I feel like the pressure from doctors really inhibited our weaning journey. Oh man, I hate that for them. I hate that. Aubrey,
Yeah, so
I
it
see you
sounds
right.
like this is a weaned kiddo, is my
Yeah,
assumption from this.
yeah.
So I mean, my first, you can ask for us to do a workup and do a second opinion, which I do all the time, and do a growth assessment. And then I give my professional opinion about whether there are any growth concerns. Second, I would ask them whether they ask any of their other patients that, because my guess
Oh,
is they don't.
they are still weaning, mid-wean.
You're still weaning. Yeah. So here's the thing. Mid-wean, we wouldn't first, we don't advise calorie counting, period. But mid-wean, especially when your kids are still, this is that whole idea of like, do we expect our kids to one for one make up the difference in our tube feeds? No.
Yeah.
No, flat out, that's not how this works. And that's one of the reasons we're doing this Q&A, because one of the common questions we get is, we've cut back this percentage, but she's only taking this percentage. So our team says we can't cut more. That is not how weaning works. That's just not how it works. And we don't expect kids to one for one shift their oral intake to make up the calories from their tube fed intake.
Yeah.
And so that's so important. And my expectation is that your provider or providers has little to no experience with tube weaning, because that's a typical red flag. So
Yeah.
I would guess that they're doing that because they're trying to make sure through their own feelings that everything is okay and they can have numbers to chart. But the reality is that they probably don't actually know what weaning looks like. And they're also trying to avoid weight loss, which again is something that we generally cannot avoid during the weaning process. So
Right.
those would be my two suspicions. So my pushback to them would be, do you ask this of other families? Period. Because I bet they don't make anyone else count their kids' calories. And how many kids have they successfully weaned? Because
Mhm.
if they haven't, then they might not know how to go about monitoring your child in the best way possible.
Yeah. And this kiddo has Noonan syndrome, so his growth is
Ah,
really closely monitored. And
yeah,
those
yeah,
tend to trend small.
they do.
Mom is sort of saying that they sort of treat him as if he should be on a traditional growth curve when maybe that's not physiologically possible for
That's
him.
not. And there's actually, so mom knows there's actually Noonan curves. And so if your provider's not using those,
Mhm.
that's another reason to either advocate that they have to use those, because we really don't expect kids with Noonan to grow at the same trajectory. Usually they're going to be shorter overall, smaller overall, period. It's kind of like if your kiddo was premature and they're not adjusting for prematurity and they're expecting your kid to be where a normal 6-month-old and your kid is only 3 months adjusted. That's giving an incorrect, that's measuring your child off the wrong standards. We can't possibly get a good sense of how they're doing if we're not using the right measurements.
Right. And even to me, even sort of the comparison, I always want to be like, well, where are normal kids? Because I'm 5'8", my kid's dad is 6'3", my kids are giants. My 13-year-old just turned 13 is already 5'6", like almost 5'7", with a size 10.5 shoe. She's gigantic because she's genetically predisposed to go tall fast. That's just what her parents are. It would be ridiculous to compare her growth to the growth of someone with whose parents are 4'11" and 5'8". It would just be insane. So yeah, I agree with advocating that they are looking at him on his adjusted. And mom is saying that they don't do any tube weaning at all. They had to fight for kind of an outside feeding therapist, and she's the one who's sort of supporting that
Yeah.
weaning process.
Yeah, and that's really hard. Getting your other consultants, because
Yeah.
we do this all the time with weaning families, putting in writing our medical opinion or our recommendations sometimes is helpful, because then a medical team at least feels like, okay, someone else is monitoring this. I think it's a lot of times from a liability standpoint. So there's just a desire to chart and make sure that's being really strictly managed. And it makes providers nervous not to be able to put numbers in there, which is why they like to weigh and measure and do all those things.
Yeah, yes, totally is. Oh my goodness. Stacy, what kinds of conversations came up for you in your journey? How did you navigate this with your team?
I think we were lucky. We didn't have much pushback. But also in like a lot of tube fed kids, we had so many different specialties, we're seeing like endocrinology, we're seeing cardiology, we're seeing GI, and like nobody wanted to own the tube. So I kind of went into all of these appointments with like, I own the tube and I make the decisions about my kid and I'm the expert on my kid, so like, I don't know. I always like tried to remind myself before these appointments that these doctors work for us. They work for
Yeah.
my kid. I don't work for them. So if they ask me a question that I don't know the answer to, or like, I don't want to be or like advocate being combative to doctors, but I think sometimes
Yeah.
you do have to be assertive and say like, this is what we're doing because
Yeah.
I'm mom and I make the decisions. But I don't want to seem insensitive because it's really difficult conversations are had in those appointments. So, but yeah, I was pretty lucky. We didn't have a lot of pushback.
That's good. I like that. I like that for you. I like that for everybody. Liz, we kind of see my child is G-tube fed and is eating more by mouth, but we had to change from formula over to blended feeds ourselves because the out of pocket is just so expensive, even if it's sort of better for her overall health. Aubrey, you love blended feeds. You love them so much. What
I
do
do.
you want to just go off on that for a minute?
They're just my favorite. I mean, whether you're doing home blends, just make sure you're working with somebody to figure out making sure you're covering all the bases. Because some families like to do like a ton of fat so that it's really calorie dense, but that won't go over well. So make sure there's a balance. But I mean, the research is really clear that if blended feeds are something that are available to you, we do see better tolerance, we see better oral intake, we see better just overall like a reduction in GI symptoms. It's just it's massively improved. My own kid went from a chronic every day following her around vomiter to like once or twice a week when we switched to blended feeds when she was old enough for blended feeds. So I see that makes such a striking difference. I also see better tolerance because I think when we have the same formula day in and day out, especially if your kid's been on a tube for a while, they hit a point that their body is kind of like, we've overdone this. And I see those intolerances and we have to suddenly switch formulas. I don't see that a lot with the blended options. Again, whether it's home or there are several blended options on the market now that you can have scripts written for, insurance coverage, DMEs cover, all of that.
Yeah. Yeah. Oh my gosh. And Stacy was Jonah was on formula, wasn't he?
Well, we had switched. The last tube food he was on was the complete pediatric blends, and he had switched from Kate Farms to that. And we definitely, I wish we would have went sooner to the blended food because it was much better.
Yeah. Yeah. Oh my goodness. Yeah, I do. And it does sound like they're working with their dietitian and seeing a lot less bloating and tolerating it just so much better. Oh, what a relief. I'm so happy for that for you. We always say you don't have to switch your kid to a blended diet in order to wean or before tube weaning, but man, I do see just so much just better toleration overall from kids on blended diets. Okay. Aubrey, you might have to help me with this acronym because I'm worried I don't know what it means. If my baby is APL, can I do the plan? He's 21 weeks old. APL, I got leukemia on that, so I'm not sure if that's the correct acronym. Mom, maybe you can for that for me. 21 weeks is okay. Tiny, tiny
So,
baby.
so generally for something like that, it's going to depend on your overall status. So if you're undergoing treatment or if you're there are active medical concerns that are being constantly monitored or treated, then usually we need to wait until we're medically stable to wean. Particularly because with leukemia and with some of the other cancers, especially, we need to be on something called a neutropenic diet, which is very, very, very limited. And so that makes it tricky to do because we're just already going to be really limited in what we can even offer. And again, depending on those cancer treatments, sometimes tastes are impacted and like all these different ripple down effects. So typically, unless a kiddo is in remission or in a really stable place, that tends to be one that we have to wait for. That's not true for all medical conditions, but this is one that it typically is.
Okay. I don't, Mom is now clarifying milk protein allergy. Maybe
Oh,
yeah. He's on Neocate and feel like he doesn't like the formula.
yeah.
But kids, I mean, people with milk protein allergies eat all the time.
Yeah,
What
we can do milk protein allergies, definitely can manage those. We have, depending on the kiddo, does it say kiddo's age?
21 weeks old. So
21
tiny.
weeks.
Yeah.
Okay. Yeah, we can definitely do that. And they can learn to take the hypoallergenic formulas. We have tricks to help them with that as well. So most kiddos can, and we've had a lot that wean with that. That's one of our most common allergies with
Yeah.
kiddos. Yep.
Yeah. I also think at 21 weeks, he doesn't know what anything else tastes like.
Correct.
So I always wonder about that. Like we know it tastes terrible because we can eat steak and mashed potatoes and pie, right? 21 weeks, maybe they don't know it's terrible because they don't have anything else to compare it to. But that's oversimplifying it. I do know that.
But we do it all the time. That's not a trick you that's not usually an obstacle to us weaning. We have lots of infants that successfully wean even on the hypoallergenic formulas.
Yeah. There are some things to try. There are some things to try. Stacy, I want to come to you. Let's come back to what you were talking about earlier. I feel like toddlers and preschoolers always pick a track when they're weaning. A lot of them take off on eating, drinking comes more slowly. A lot of them take off on drinking, eating comes more slowly. Jonah was definitely a takeoff on eating, and drinking comes much more slowly. So tell us a little bit about hydration as you went through that process and what it was like as he was sort of learning how to drink, and that was really not coming on board the same way that eating was.
Yeah. Um, It's so hard sometimes to talk like logically or rationally about it because I think I was so emotional about it.
Yeah.
We kept the tube in for a long time because I was still using it for water, and I think I probably did him a disservice a little bit because maybe he wasn't experiencing thirst. But I will tell you that I bought every cup on the market. I have a box in my kitchen of like, I regret buying so many different cups. I should have just stuck to one. But you know, I ended up for a really long time just like thickening his water, and that seemed to work. That's how we weaned him fully off the tube. And he drinks milk fine. He still to this day like struggles sometimes with very thin liquids, and there's no issues with his swallow, and he doesn't have like respiratory problems. It's just water has just been hard for him, but we're fine now. Clearly I still have like emotions tied up in this. He still doesn't drink like a ton, but anyway, he ate like a champion, and he eats tons of like hydrating foods. He loves all the cucumber and tomato and watermelon. Especially in the summertime, it's really fun because he's just constantly eating like all of these juicy fruits and vegetables. But yeah, the drinking was a real struggle, and I super stressed out about it like constantly. And looking back on it now, I should have listened to you a little bit better and just understood that like it was going to be a challenge. I was just I was like, if we can just buy it, there must be a magical cup out there that he's just going to like take off. I will say those reusable pouches that I know, Elizabeth, you remember that's when we started the wean, I bought these reusable pouches, and I was able to like put oatmeal or yogurt or whatever in them, and you can make it like as thick or as thin as you want to. So I just started making things thinner and thinner and thinner until he was just like drinking milk consistency. And then it's been a year now that we're working on water. But he's a champion, and like I said earlier, weaning is such a mind shift for parents. And I think that's like my moral of the story anyway, is it was all about like me shifting my mindset because he was going to be fine.
Yeah. Yeah. I do think parents like I think it's not even just true for tube weaning. I think it's just parenting. It's sort of like as your kids get older and things change, you really have to sort of wean from one way of doing things and one way of interacting with your kids to a completely different one. It's like the thing I hate most. Parenting, nothing stays consistent, drives me nuts. But yeah, I think there is just this sort of process of just letting go and trusting that your kiddo can be safe. And that's very hard when they weren't safe, right? There was a time when they weren't safe. And so there's that big connection to those times past. I'm
And
listening.
I think
Yeah.
I just wanted to add to with the hydration piece. I was just thinking about, I have 4 kids for those who are viewing. Only one of them was tube fed. And I was just thinking about how, we tell you to tell us if there's dehydration, if there's any signs of that. And yes, that can be dangerous, especially if you've got a little baby. On the flip side of that, my kids love to not drink water all day and then complain to me that they have headaches. And I'm like, drink water. None of them are going to the hospital. None of them are in danger, right? They're uncomfortable and their body is communicating to them. So I say that just because it is okay for your kid to get to a point that maybe they could have had more water that day, and for us to respond to that or them to respond to that. It's not life-threatening, generally speaking, if they had 3 wet diapers instead of 4. Do we want to correct that? Absolutely. But is it right now immediately probably going to be a threat to them? Not in most instances.
Right.
So I think again, that's a helpful, like I was just thinking about my kids right now. I was like, God, they are so dehydrated because they refuse to drink water in the summer. So this is like a common conversation that I will check their water bottles and be like, hey, why are these all still full? Sit
Mm-hmm.
down, drink some water. And like
Yep.
we have to have that conversation because they get so busy playing.
Yep. Same. My kiddos, I'm like, hey, we're absolutely gonna pee sometime today. Let's get on it, or how about some Gatorade? And I have learned my oldest she plays all the sports, and she gets a Gatorade or a liquid IV packet every day. I know she's got practice because that girl needs it. She needs a little extra electrolyte hydration boost. So it's a thing for sure. I
I
want
was
to,
thinking back though to my childhood. Nobody ever was asking me to drink water. I think I drank like one Capri Sun a day, and my parents were not concerned. You know what I mean?
same. I don't think anyone ever checked my,
People didn't carry around water bottles in the 80s and 90s,
no, they did
It's like,
not.
so,
That's
and we
because
all
they
live.
drank out of hoses. Come on. We like
That's true.
just drank out of
Fairness,
the sprinklers and stuff.
for the
Like
record, hose water is amazing. I believe still to this day that hose water is amazing. It's
I'm
probably
just saying. That's why there were
but
no water bottles because we just
for
drank out of the
real.
hose.
Oh my gosh, for real. Liz is saying that her kiddo is 11, almost 12, and is asking about when she will no longer need her tube. She's had a tube since she was 1 year old. That's some buy-in. Oh, I love that. I really think that age group, it's all about like buy-in, all about buy-in. So Aubrey, and then Stacey, I'll come to you and then I'll add some thoughts. But if this was your kiddo, how would you talk about that?
Yeah, I mean, I will say we had an older kiddo and we never shied away from talking about our daughter's tube with him. And so part of our conversation was around like, yeah, right. Like, how do you eat? Oh, you eat with your mouth. Yeah. How does she? Oh, she eats through her tube. And we just talked about it in that way. And so I think in an age appropriate way, you could talk with your daughter because I have no idea what the circumstances are, if there are medical needs, if they're, developmental, I have no idea. But just kind of having, yeah, we're hoping, is that something you'd like? That would be something we could work on. First, we need to make sure you can get all this good nutrition through your mouth before we can stop using your tube. And if you can do that, we could work on that. Is that something you want to work on and see if that's something that feels safe to her, feels comfortable to her, feels exciting to her. And if she's in a stable place and that's an option, then kind of moving forward. I mean, that would be a kid that I would definitely have more involved with the wean and the process than we currently do with a lot of our kids, because a lot of the kids we wean are younger.
Yeah.
But she would be a kiddo that I would have involved in the conversations and in what, like, here's the plan. How do you feel about that plan? And seeing how she felt about these next steps. And also a really cool thing is that she can also articulate better what doesn't feel good about eating, or oh, my belly really feels full, or oh, is this hunger? Is that what I'm feeling? Whereas our 2-year-olds are just angry and we have no idea why. So I think actually it could be a really great experience for her.
Yeah. Yeah. I think the one thing I would not say is, well, we can get rid of your tube when you decide to eat. I think I
Correct.
would avoid that kind of language because
Yes.
the reality is, that's a lot of pressure, especially at
Mhm.
that age. And I'm just gonna assume typical development, although I probably shouldn't, but that's a lot of pressure for that age. And I think the reality is, fed is best, whether you're eating with a tube or you're eating with your mouth. And I think framing it as both of them is eating.
Mhm.
Yeah, right now you eat with your tube. Are you wanting to learn more about eating with your mouth?
Mhm.
Does that sound like something you'd be interested in thinking about? Let's talk about what that would look like. We've certainly weaned that age group before. And so I really think, really getting your head around how do we talk about um, her eating in a way that feels empowering and supportive and not as if tube feeds are the repercussion for not eating. They're not. Tube feeds are the way her body has stayed safe for a decade, right? And that's a gift. And so when we think about talking about eating both with your mouth and with the tube and really just gauging her level of buy-in, and that's assuming that she's medically stable and safe to wean. And if she is, then gosh, find us. We'd like to help you. Stacey, would you add anything to that? What's your thought?
No, I just like what Aubrey said, I think it'd be so cool to be weaning a child that can express themselves, you know.
Yeah. Yeah. Um, two more questions. Do we have time for two more, you think? Aubrey, this one's going to come to you because it's a weight question. This is your favorite kind. My baby had a tongue tie.
Oof.
Tongue tie and has an aversion to the bottles, underweight, and has had an NG tube for a month and a half. I have to wait for the question is, do I have to wait for him to be at the best weight to schedule the initial appointment?
As the intake coordinator, no, when you submit the
Yes.
intake, when you submit the intake, all we're looking for is if your child has been growing consistently, and that just means in the range expected for that age. I mean, it depends on the child's age. At that age, probably a month or so, we would just want to make sure that we're seeing them go up. Absolutely, that if they're below the weight that they got the tube at, that would be concerning, even if they've been gaining. So we would want to see some consistent gain, knowing that they're growing well, because we know and expect weight loss during the weaning process. So we don't want to go in already in a deficit. But there is no magic weight. There is no magic percentile. There is no required anything. I always like to use my daughter as an example. She was a 30 weeker. Never made it to the unadjusted growth chart before we started weaning. So she was super tiny, and we had no concerns about her growth or her development when we weaned at that time, even though she was, again, not even on the unadjusted growth chart.
Yeah. Yeah. I love your phrase. I steal it all the time. I should quote you or cite you, but I don't. There is no magic percentile. There is no best weight. What we want to see is steady growth, and that the issues that led to the food refusal, if you know about them, have been sort of considered, managed to the best of your ability. But if you're sort of like, I don't know, we don't even know why he didn't eat. And there is a demographic of kids where we never really know why they landed on a tube in the first place. If that's you and I mean, the reality is you can come find us now. And if we think that there's some pre-wean work to do, we will help you. In that pre-wean phase. We will help you work through adjustments to make and whatnot. So I know this mom is asking, like, how in the world do I find you? So I will come back, Liz, and I will I see a couple of moms are asking about that. I'll make sure that you have access to our website and to our intake, but the brief of it is gieaters.com. You can find us there. But yeah, if you have some idea and you're just curious, we'll take a look. We would be happy to take a look.
And I just wanted to add really quick to that, because you said, that we want to try and resolve whatever led to the tube. That doesn't mean we have to resolve an oral aversion. An oral aversion is not something that we expect to resolve until we start weaning. What we want to resolve is anything that might have led to the oral aversion: uncontrolled reflux, a food sensitivity, an unsafe swallow, all of those things, but not an aversion itself. Because I think a lot of families are like, my baby's averse, can I wean? Yes. Absolutely, we expect them to be adverse.
Yeah.
Yes.
Yeah. Yeah. And in the meantime, protect it from getting worse. Be super responsive. Offer with no pressure. Find your nonchalance as if you don't care whether they eat or not. And I know you do, and that's really hard. Poker face, right? Like, it really just protecting it from being more pushed or in the meantime. And we'll help take a look at all of that. Okay, we're going to talk hydration. Again, coming back to hydration, but we're going to do so with the lens of a kidney complication. So kiddo, with kidney disease. So had a kidney transplant about 8 months ago. I'm terrified of meeting hydration requirements during a wean. We haven't started weaning. He's 100% tube fed, 2 years old. Oh yeah, that's a thing. That's a thing. Yeah, I have a thought on it, and then do you guys want to add to it from there? I think that, one of the questions that I start to ask, there are certain conditions like kidney disease, for example, where some kids need like more water than they could ever possibly drink in a day just to keep those kidneys functioning. And in those cases, we focus as best we can on weaning nutrition so that they can be as oral as possible, even if they need additional hydration support at night or whatnot to sort of meet that minimum goal. And I think we have a lot of families is actually in that case with kidney complications, whether it be a kidney transplant, sometimes with a liver transplant too, that happens. And in that case, we focus on nutrition and we focus on offering and then topping up whatever isn't drank like overnight. And so there are definitely ways to move towards being more oral in that case, and with protective, a protective stance around those kidneys to keep them nice and safe. But I don't think that prohibits a wean. It just means the wean might look different. Aubrey, what do you think?
Yeah, and I will note that a lot of times it's the high needs are very like an acute situation that initially after the transplant there's a more of a requirement for that, and then as time goes on there's less of a requirement. But I will also say that this is an important time to ask that team, how do you monitor this in oral kids?
Yes.
Because they like to treat tube fed kids very differently than they do oral children. And you cannot make children drink. You cannot make them take these vast quantities. Kids that are going to school, their teachers are not calculating how much they've been drinking. So I would challenge them and say, how do you keep an eye on this with an oral kid? How do you do this? And typically they do some more labs and they have other markers that they're looking for. And so they are typically offering a fluid goal that they know will keep you safe, versus the minimum that would actually be required to keep your child safe.
Right.
So that can be helpful too. Just having more information about what if my kid wasn't tube fed, how would we have monitored this? Yeah.
Yeah. The big question I think there is, if my kiddo had never, like, would you put a tube in? Right? So let's say my kid was oral. Would you put a tube in him in him or her in order to meet that fluid goal? And if you wouldn't, why not? What kind of flexibility do we have there? I think ultimately the question we always want to get to is your child safe to a point where we could monitor hydration by what's coming out, by looking at pees and poops? And there are conditions where that's not possible. There are few conditions where that's not possible. So ultimately asking those questions to say, is he in a place where you would otherwise pop a tube in? If not, then is he at a place where we could monitor hydration by what's coming out? And if not, what does that look like? But there are lots of ways to take great steps forward, even if we maintain hydration support for a certain time.
And if you're in like a support group with other, because I know a lot of parents with kiddos with medical conditions, if you're in a support group with other families who have kids who are getting kidney transplants, ask them, hey, your kid doesn't have a feeding tube. How do you get their hydration in? Find out what they do. What are their tricks or what are their requirements? Because that can, again, be a helpful way to just kind of inform you and give you a second opinion around the best way to proceed and make a plan for your kid.
Right. Absolutely. And again, my best advice to all of you who are sort of looking at like, where can we get help? How do I know if my kiddo is safe to wean? Is going to our website and fill out the intake form and give us really as much information as you possibly can about what you do know, right? If you're like, I don't know if my kid can swallow safely, he's never swallowed. Say that. That's super helpful for us. If you're like, I don't know if kidneys are safe to wean hydration, we can help you know what questions to ask. And then based on the answers, help make a plan forward. But I think the biggest hope that I have is that there's almost always a great way to be more oral. And if there's a way forward, we will find it. We will find it. So whether you have an 11 or 12-year-old or a tiny new 21-week-old, wherever you're at, definitely reach out to us because we want to be helpful. We want to help figure out a great way forward. Right, Stacy? Stacy gets to listen to us go off and off.
Oh, I love listening to you. Yeah, we want to help.
We do. And I will definitely, to everybody watching, gosh, we really went over time. Sorry, everyone. But I will definitely post a link to our website, specifically our intake form, so that we can take a look and give you our best recommendation on how to move forward. I do feel like we're like the team where if there's a way, we see it somewhere in there. So to all of you who are really, really kind of stuck in either weaning world with a medical team that's just got a lot of pressure, or you are pre-wean, or you're post-wean and you're trying to figure out how your toddler is possibly going to eat, survive on the one cheese stick they ate today. I just want to cover the whole situation with a ton of hope. Oral eaters, especially toddlers, are such fickle pickles. And there are so many ways to take great steps forward. And if you aren't sure where they are, we will help you find them. So find us and we will come into that crazy swamp and find you. We're so excited to work with you, and I will definitely post all of our information down below. But until next time, hey, happy Sunday to everybody. Have a wonderful evening. I'm going to go make Greek food for my kids. So happy Sunday, everybody.